Hello, my name is Daniel. I came from Madrid and I'm an aesthetic doctor, and she is Maya, the perfect patient for me. And we are beginning the treatment. First, explain why she wants to make this treatment with polylactic acid, and how I make the entry points and the treatment areas. Okay? First, you can sit, vertical sit. Wait. I don't make an anatomical explanation, only areas of treatment, right? Okay, first I want to see the front plane, where we can see her shape, frontal shape. When we continue, she has a good theomatic arc, but here continues, and she has a short angular mandible. Okay, jaw angle is a zone where we can put attention during the treatment. Why? Just now, in the lateral plane, we observe another depression. She has a little negative vector here that is explained, but she has lost the deep fat here, okay? And this zone mark for possible treatment here, okay? And in the future, if she wants to treat the lacrimal circle, okay, we need reposition here. And we begin with the polylactic acid. In a 2 months, we can see again, and we value if hyaluronic acid here is necessary, okay? And another tip from here. In the lateral plane, the piriform force is another zone to think for our treatment. And at last, the mentalis depression, okay? She is a young woman, and his jaw is smaller, but it's a zone, this zone is heavier. And here, I don't want to put any product, okay? It's better in zones to project. This zone, not for treatment, okay? Piriform force on the left, and the mentalis depression on the left, okay? Then, I begin my treatment with only about 2 or 3 entry points. This one, that gives me the possibility to the temple, to the zygomatic, also the posterior pillar here, okay? There are ligaments, musculocutaneous ligaments, that potent the lifting effect, okay? And no volume. These are round face, no volume here, okay? One entry point. The other entry point, to reposition of this volume, maybe in the vertex of malar anterior, okay? Anterior malar, the other entry point. It's not for treatment, it's not for treatment, okay? And the other one depends if you want to treat from here with the cannula, only use the cannula to treat directly the chin and the jaw angle, okay? And the other side the same. This is a very symmetric face. Don't lose too much volume on the left, on the right, okay? Thank you, Maya. First, we prepare at first time this morning the vial of a step field. Do you know that is a PDLA polylactic acid? And you can see only with water for injection. It's an homogeneous solution. If you wait a few seconds, you can see no rest in the vial, okay? But, and just now, we put lidocaine, in this case, 5 milliliters of water for injection and 1 milliliter of lidocaine 2%. Este field says that 15 minutes is sufficient for the dilution. I prefer, if you can, 1 hour, okay? Because the hydration of the product is better. 15 minutes or 1 hour, don't change the easy injection, don't change the low inflammation in the patient, but I think, in my opinion, you obtain a strong effect, okay? Because the polylactic acid can obtain a diffusion fast. Well, it's sufficient. With this design, I will put about, because the depression is very bit, a bit depression, here I will put about 0.3, here about 1 milliliter, okay? And I will see if I put in the other vector, okay? To obtain best lifting effect here. Okay, as I say, the first entry point, pinch, put only the visual on this point. Okay. Wait, I prefer give to the hair, because with cannula, sometimes you are near the hair may be clean or not. You clean your hair, but okay, right. I know, but it's better for reduce the possible infection of the abordation point. Chlorhexidine works in a few seconds. Never chlorhexidine in the ACE, please. Thank you. Bye. Okay. We have the portal, subcutaneous. Here, go slow. You can see the tip of the cannula and go to the frontal limits, okay? You can see it's a good treatment for the temple, okay? Suave. Another vector. I go repositioning the product, slow. Are you okay, Maya?
Yes, absolutely.
I know. Okay. You can see, yeah, a new volume here, okay? Okay. Do you know that the treatment of the temple give us a little lifting effect in other thirds? Go down. From the same point, slow, we go to the malar, anterior malar, and retrovectors. Here, if the loss of the volume of this zone is very high, you can use two planes to obtain the better reposition of the tissue. Okay. Change the plane, and with the cannula inside, we change the vector in the other direction. Okay. Sit down, please. Just now, you can see the difference. This result is near the final result in a few months. It's a flash result in a few days, go down, but give us an approximating result. Right? Okay. Let's go. This point that we're talking about at first is a loss volume point, and I will put a little bit amount of product in the piriform fossa from this one. Okay. Only the vessel. Wait a few seconds to enlarge the skin. Okay. Another 2 cc. From the entry point, I prefer first correct this loss of volume because of time a little bit the lift effect from here and not so correct in this zone. Okay, I go slowly to make comfortable the treatment. Okay, you can see it. Oh. With the other hand, the hand that helps us to not trespass the retenedor ligament of the orbital. Okay, a little bit more, because we obtain a better skin of quality, but it's a product can obtain a variable amount of collagen in this area and produce a little volume here with a natural result. Okay, you can see, sit down please, in the lateral plane our negative vector is resolved. Okay, you can see it? Let's go with a bit amount about 0.2. is not a cohesive product, but in the correct plane give us a better results for volume. Here, slowly, don't forget the facial arteria here. How do you do? How? Are you fine? Yeah, here?
I'm okay.
Okay. Okay.
And you are okay?
I understand. I'm okay if you are okay.
Okay.
We are together okay.
Okay.
Okay. It's a piriform fosse very deep, and I put about 0.3. 0.2, 0.3. Okay. From here, we can go to the mentally zone, depression, as if you prefer, from here. It's the same, okay? She has a deep, and I want to put something from here, okay? Here. I will open. We changed. Sorry, I'm right-handed, and I can hear. Here, slow is an uncomfortable zone. I put a little bolus of product to promote the anesthetic. And another vector for this zone, a little. You can make here a little subcision with the cannula without product, okay, to obtain better results. I not put just now the product, only pass the cannula in this zone. You can see another version of this zone just now, okay? And I put another two verso about 0.1 in each vector. Okay? Right. We mark this zone with a heavy zone. Okay? The entry point will be here, and I here put another vector to obtain a better transition between chin and jawline, and in the other side to promote the obtain along a better jaw angle. Okay. And just on the bone line and make just stop here, okay? Another vector, just stop here with the hand that helps you. You can feel where are you with the cannula and when you stop, okay? Okay. Thank you. How much? Over. This is the last 2 milliliters. From the same point, go in the opposite vector Slow injection. We normally stop about 1 centimeter for the entry point. To give more leaf effect, I work at the posterior pillar. Deeper. And just now in a more superficial plane. Okay. Sit down, please, Maya. We have here the pencil, but I think you can see the difference between two middle face, okay? Maybe the lips are
Right,
asleep, okay? Okay.
Mm-hmm.
Okay, but it's normally. You don't have any problem. We have a mirror. You can see it, okay?
Mm-hmm. Perfect.
Perfect.
Can I go?
Okay. Any question? Great.
How much product have you used till now? How much product have you used till now?
6 milliliters. A complete beer with the dilution 5, water for injection, and 1 of lidocaine 2%. Okay? Is too much? No. You can see, but we have put 6 milliliters in his face, in her face, but it's not a heavy face. Okay? And it's better the repositioning of the tissues in the middle third, and you can see better definition of jawline. Okay. In a few days, go down, and in 2-3 weeks, you can see the results. That the better of this product, that the patient feel the change. Okay, let's go. Portals ring. No problem. Again, give me the chlorhexidine, please. Okay. I prefer spend the time in the correct preparation of the zone, okay? Reduce more complication. And also takes a few seconds. When you have a deep depression here, in my opinion, first deep reposition with hyaluronic acid here, and in the dermis with Astefil is a very good combination for this zone. In a few days, the cadaveric phase is gone, has gone.
And how long do you wait after the application of hyaluronic acid?
Sorry?
How long you wait? You put the hyaluronic acid?
In the same act, in the same moment. There are different planes, total different plane.
Okay,
No problem. No problem. because in the first valoration you see the depression, you correct, in a few days go down the inflammation, the breathing at all, and the polylactic go down. In a few days all work together and you obtain a good result. You can wait 2 weeks if you want. Okay, another entry point, the same, the other side. Sorry.
It's okay.
Sorry. Thank you. We go to the temple. Slowly. You can see I'm in the plane. To the frontal sutura here. And I put retrovector only in this zone. The veins here, do you know, that engross with the stress of the treatment. In a few hours, reduce by herself. Okay, it's sufficient because there are a little bit depression. From the same point, a lateral point, where in the correct plane, go to the anterior malar zone and work another vector. So another. With these vectors, we work another zone with the wrinkles, fine wrinkles here. There is a zone for Botox, for botulinum toxin, but with the polylactic acid, we can obtain better enduring the strong the skin here, and this combination obtain a very good result and enduring result. Okay. From this point, okay. Thank you. Go to the hard limits and give. This is the point for the models. The beauty point. Okay, how do you feel?
Yeah,
Okay.
perfect.
First, another. Well, the next point, a little bit the position here, and the piriform fossa. This point is my entry point, only the visual. Thank you. Turn. Okay. Here we go. Slowly. I'm certain where I want to put the product to correct of label, you can put with another dissolution a little bit amount of product in the lacrimal surface, because it's a very secure product, but in other dilution, more diluted, okay? About in 6 milliliters of water for injection and 2 milliliters of lidocaine. The same for the egg. I'm going to the P-form force. Okay, and I will put here about 0.3 in this zone. At this moment, I prefer to see the patient from this plane, because the negative vector you can see better from here, okay? And I try to find the correct symmetry between two hemifaces, okay? It's better. It's okay for me. Go up again. Okay. Let's go to the mentalis depression from our second entry point and go down slowly. Here is the ligament, and I put a little amount of product to make anesthetic effect, and the 2013. If you pinch here with the other hand, it's more comfortable for the patient. Slowly, I make a substitution. Okay. And I will put a little bit amount of product, about 0.2. Okay. Fine. This is the last, no?
Yeah.
Okay. And our third point, entry point, this is our heavy zone, the joule. Only, sorry.
It's okay.
Let's go. Sorry. If you feel that the cannula not pass, you can make a rotation to attain the good plane. Here we go. We go over bone line, fronting, at last, our limit, heavy limit. Stop here. Stop here. And stop here. and because I'm a right-handed, I will go from here to the jaw angle. Okay. And first define the jaw line. And just now, I'm going to the musculocutaneous fibers to promote the lifting effect in this area. Slowly, first deeper, deeper, and just now change to superficial plane and put a little amount of product, and it's okay. Yeah, we finished.
Oh, perfect.
Okay, sit down, please. Whoa. We have a little amount of bruising because it's a chloresine with alcoholic solution, and she has a rosacea, a little bit of rosacea.
Why?
But this is the initial result, okay? This go down in a few days and go up in 2 or 3 weeks. Let's go to finish. I love the massage. There is not necessary for this product. With other polylactic acid, we need to massage the thumbs 5 times in a day, 5 minutes, every 5 hours, 5 days. With this product, no. This night, she make normally routines with her products, and this massage for me is important to guarantee the correct integration of the product, and I can see if I make sticks of the product in any zone, if I make a lesion on a vessel and prevent her to put arnica in this zone, and the best is give her more comfortable finish of the treatment. Okay, it's better.
The best part.
The best part. So strong?
It's perfect.
Perfect. Okay.
No, then you can make a bag, you know.
I can continue, but
If we have time.
have another price.
Oh my god.
No. No, a little bit. Thank you. Don't forget the temples. Well, this is the, sit down please, the finished result, okay? Perfect. Give me the mirror, please.
Perfect.
How do you see?
Thank you so much. Oh, amazing.
In a few
This
days,
part,
better. Okay,
Uh-huh.
and you can touch.
Massage.
No, you can touch and feel the difference
Yeah.
in the low third,
Mhm.
okay?
Well, definitely, it's feel like more tightened.
Oh, my tighten, okay.
Perfect. Thank you so much.